I'm Andrew Douglas. I'm a consultant clinical geneticist in the Oxford Centre for Genomic Medicine. And what I do is I see patients who are referred to us who might have a genetic condition or who might be known to have a familial genetic condition that they're at risk of inheriting. I've been asked to talk about some of the work I've been doing with the Oxford Motor Neuron Disease Research Group, which has mainly been looking at what we call the penetrance of disease in genetic forms of motor neuron disease. We know that a lot of people who might have inherited a genetic mutation that is supposed to cause motor neuron disease might not actually go on to develop the condition. And I've been studying that, trying to work out what does that mean, and eventually we hope to try to understand why it seems to vary from person to person. So I was trying to relay that and talk about some of the future work we're hoping to get through that research. We have this study, which is called the ACORN study, set up by Dr. Alex Thompson, who's a colleague, and that is recruiting lots of people from around the country who have inherited the C9orf72 repeat expansion mutation. That is the most common factor associated with motor neuron disease in European populations. As part of that, we are gathering a lot of family history data, and the family history at the moment is the best indicator we have of individuals' risk, and we can use that to try to work out what an individual person who's at risk of the disease, what is their risk of actually going on to get the condition. So we're collecting more families and getting an idea of the range of risk that exists, and we're finding that's really quite broad. And once we know that, then we want to go and look in more detail at the genetics of those individuals to try to work out what's the difference between those people who seem less at risk and those who seem more at risk. And we hope that by understanding that, we'll be able to find out what is potentially protecting some people from getting this condition. If we can do that, then actually we might find targets that we could use as potential therapies to help prevent people from going on to get motor neuron disease. One of the key things that we're trying to understand is to work out why some people are at less risk of motor neuron disease than others, even though they might have the same genetic mutation. Because if we can find out what's protecting some individuals from getting motor neuron disease, then we might be able to apply that to other people and actually come up with some sort of therapy that could prevent people from getting motor neuron disease in the future. I think the field of genetics related to motor neuron disease has changed really dramatically since the first gene was discovered some decades ago now. And the rate of change has been so great, it's really actually very hard to know how it's going to be in another sort of 30 years. But I think that this period of time, this part of the 21st century, is where we start to translate what we've understood about genetics into potential therapeutics and gene-directed therapies. And I mean, this is already starting to apply in motor neuron disease. We have the SOD1 antisense oligonucleotide tofersen, which is showing an effect. There are similar effects happening in the FUS-related motor neuron diseases. And I think as we start to understand more about how individual genes are causing risk of motor neuron disease, we'll slowly get more and more targets that we can actually individually look at and manipulate to try and alter people's risk. So I think that this period, people, I hope, will look back and say this was a golden age of discovery and where we understood how to molecularly treat and hopefully prevent motor neuron disease. So I think actually continuing what we're doing to try to work out what are those individual molecular factors that are dealing with risk is going to be really key. And understanding, unpicking potentially the difference between somebody's risk and what happens once somebody gets a disease. That might be different. It might actually be a different set of genes that are going to influence somebody's progression compared to somebody's risk when they're younger and healthy. So I think days like this FaTHoM Day are really important. They help bring together different people involved with research, involved with the clinic, and also, very importantly and most importantly, the families who are affected by this condition. And actually it's really thanks to them that we can start to do some of this research, because without them we wouldn't have the family histories, we wouldn't have the samples and the data. So I think these sorts of events really help to generate interest and excitement, and help also to recruit more people to our studies. So I hope that we can continue doing them, and that they'll lead to major improvements over time.